Dgroups, an established entity since 1999, has solidified its presence in the South Asian region, in Andhra Pradesh, with Hyderabad as its capital. And Pan-India Service. We specialize in Occupational Health Center, OHC, services, comprehensive sales, and service of medical equipment, as well as offering cutting-edge lessing services.
Cath labs are an important part of treating heart conditions. A catheterization laboratory, or cath lab, is a procedural hospital room where minimally invasive tests and procedures are performed to diagnose and treat cardiovascular disease. The procedures performed in a cath lab involve tiny, flexible tubes called catheters, which is where the name is derived from. These catheters can be used as an alternative to surgery to access the heart and blood vessels. Common cath lab procedures include cardiac coronary angiogram. This procedure evaluates the blood vessels supplying the heart using catheters and X-ray dye. Coronary stent placement, a procedure in which small metal scaffolds are placed within a blocked coronary artery to keep an artery open. Right heart catheterization, a procedure in which physicians examine blood flow and pressure filling in the right side of your heart. Function and history. The catheterization procedure was pioneered by Dr. Werner Fistmann, a German surgeon, in 1929. Dr. Fistmann performed the first human cardiac catheterization on himself by inserting a catheter into his own arm vein and guiding it into his heart. The development of catheterization techniques and the establishment of dedicated cath labs followed over the years. Use of cath lab. The cath lab is primarily used for the following procedures: angiography, imaging of blood vessels, particularly coronary angiography to visualize the coronary arteries. Angioplasty, a procedure to widen narrowed or blocked blood vessels, often involving the use of a balloon-tipped catheter. Stent placement, inserting a small mesh tube, stent, to keep a narrowed blood vessel open. Electrophysiology studies, mapping and ablation of abnormal electrical pathways in the heart. Advantages: allows for minimally invasive diagnostic and therapeutic procedures. Provides real-time imaging of the cardiovascular system. Shorter recovery times compared to traditional open-heart surgery. Disadvantages: potential for complications, including bleeding, infection, and damage to blood vessels. Radiation exposure to patients and healthcare providers. Limited access to certain areas of the cardiovascular system. Precautions: patients should inform their healthcare providers about allergies, current medications, and pre-existing conditions. Strict aseptic techniques are followed to reduce the risk of infection. Continuous monitoring of the patient's vital signs during procedures. Cath lab procedures involve the use of catheters, which are thin, flexible tubes, to diagnose and treat cardiovascular conditions. Here's a general overview of common cath lab procedures. Angiography. Purpose: to visualize blood vessels, particularly the coronary arteries supplying the heart. Procedure: a catheter is inserted into a large artery, typically in the groin or wrist. The catheter is guided through the blood vessels to the area of interest, for example, coronary arteries. Contrast dye is injected through the catheter, and X-ray images are taken in real time to visualize blood flow and any blockages. Angioplasty. Purpose: to open narrowed or blocked blood vessels. Procedure: a catheter with a deflated balloon at its tip is advanced to the narrowed or blocked area. The balloon is inflated, compressing the plaque or blockage against the vessel wall and widening the artery. In some cases, a stent, a small mesh tube, may be inserted and expanded to help keep the artery up.
Stent placement. Purpose: to maintain the patency of an artery after angioplasty or to treat atherosclerosis. Procedure: a stent is placed over a deflated balloon on the tip of a catheter. The catheter is guided to the narrowed or blocked area. The balloon is inflated, expanding the stent and pushing it against the vessel wall, holding the artery open. The balloon is deflated and removed, leaving the stent in place. Electrophysiology studies, EPS. Purpose: to diagnose and treat abnormal heart rhythms, arrhythmias. Procedure: catheters are threaded through blood vessels to the heart. Electrical signals within the heart are mapped to identify abnormal pathways. Ablation may be performed, where small areas of hard tissue causing the arrhythmia are destroyed using radiofrequency energy.
Percutaneous coronary intervention, PCI, purpose, an umbrella term that includes angioplasty and stent placement to treat coronary artery disease. Procedure combines angiography, angioplasty, and stent placement as needed to restore blood flow to the heart. Patient preparation and aftercare. Patients typically undergo a thorough evaluation, including medical history and diagnostic tests, before the procedure. Fasting is often required before the procedure. The cath lab team will monitor the patient's vital signs throughout the procedure. After the procedure, patients are observed for a period, and they may need to lie flat for a few hours to prevent bleeding at the catheter insertion site. Recovery times vary depending on the procedure and individual patient factors. Cath lab procedures are performed by a specialized team, including interventional cardiologists, nurses, and technologists, in a controlled environment with advanced imaging equipment. The choice of procedure. Complications of cath lab. While catheterization laboratory, cath lab, procedures are generally safe and effective, there are potential complications associated with them. Complications can arise during or after the procedure. It's important to note that the likelihood of complications varies based on the type of procedure, the patient's overall health, and other factors. Some common complications include bleeding and hematoma. Bleeding at the catheter insertion site is a common complication. In some cases, a hematoma, accumulation of blood, can develop at the site, leading to swelling and discomfort. Vascular complications. Damage to blood vessels can occur during catheter insertion or manipulation. Vessel perforation or dissection, tearing of the vessel wall, may occur. Infection. Despite the use of aseptic techniques, there is a risk of infection at the catheter insertion site. Allergic reactions. Some patients may have an allergic reaction to the contrast dye used during kidney damage. The contrast dye can affect kidney function, especially in patients with pre-existing kidney problems. Arrhythmias. Cardiac arrhythmias may occur during or after the procedure, especially in electrophysiology studies. Coronary artery dissection. In angioplasty procedures, there is a risk of creating a tear in the coronary artery wall. Dissection. Thrombosis or embolism. Blood clots, thrombosis, can form on the catheter or stent, leading to blockages. In rare cases, small particles can break loose, embolism, and travel to other parts of the body. Radiation exposure. Healthcare providers and patients are exposed to ionizing radiation during the procedure, which carries some risk. Stroke. In rare cases, there is a risk of stroke, particularly if emboli travel to the brain. Allergic reactions to medications. Patients may have allergies or adverse reactions to medications used during the procedure. Delayed complications. Some complications, such as restenosis. Stents are medical devices used to treat narrowed or blocked blood vessels, helping to restore blood flow. There are different types of stents designed for various medical applications. Here are the main types of stents. Coronary stents. Bare metal stents, BMS. These are metal mesh tubes placed in narrowed coronary arteries to provide structural support. They help prevent the vessel from collapsing after angioplasty but do not release medication. Drug-eluting stents, DES. These stents are coated with medications that are slowly released over time to inhibit the growth of scar tissue inside the artery. This helps reduce the risk of restenosis, where the vessel narrows again after the procedure. Peripheral arterial stents. Peripheral arterial stents are used to treat blockages in arteries outside the coronary arteries, such as those in the legs, femoral or popliteal arteries. They can be bare metal or drug-eluting, similar to coronary stents.
We sincerely appreciate you taking the time to watch our content on Dgroups. Your support means the world to us, and we are thrilled to have you as part of our community. If you enjoyed what you saw, don't forget to hit that subscribe button. Subscribing ensures that you stay updated with our latest videos, updates, and exciting content. By subscribing, You become an integral part of our growing community, and your support inspires us to create more engaging and valuable content for you. Thank you for being a part of the Dgroups family. We look forward to bringing you more entertaining and informative content in the future. If you have any suggestions or topics you'd like us to cover, feel free to leave a comment below. Once again, thank you for your support, and we can't wait to share more exciting moments with you on